So we're going to demonstrate the assessment and setup for the flexion distraction table. We're going to start by asking the patient to get down on the table. When you get down, just keep your abs tight, your glutes tight as you lay down. We're going to make sure the table is locked out before they get on. And go ahead and lie face down. I'm going to ask them to position their hips to where the ASIS is about 2 inches or so above on the dorsal piece. And then we're going to go ahead and set the foot bar in order to be in a position where it's going to be able to hold them with some tension on their spine. That'll end up being adjusted again later. Once we've done that, we're going to go ahead and take them through the process of tolerance testing. Now with tolerance testing, we're going to start with just the tiller bar in place. We're going to palpate to find L1. We're going to go ahead and apply a cephalad pressure on the spine and unlock the table. Now in this case, you'll see there's a lot of tension on that table that just popped up. So I'm going to come to the end of the table here and loosen the tension a little bit so it doesn't put too much stress on my spine. I'll loosen, unlock the bar, find L1, take that cephalad contact, and I'm going to push down, usually about 2 inches or until the occiput tilts backward. I'm going to hold that for 4 seconds, then come back up. Do the same thing at L2, then L3. And I'm going to do this at each level until I get to the top segment of that dysfunctional one with the disc herniation. Once we've completed that, if they did not have any peripheralization or reproduction of their symptoms, I'll go ahead and strap the unaffected leg in. In this case, we're calling his right leg the unaffected. Repeat that process at each level. Then we'll strap in the affected leg alone. And then finally, if they tolerate all the way through, we'll strap in both legs and repeat that process of tolerance testing. If they did not have any reproduction or peripheralization of their symptoms, we'll go ahead and continue on with treatment. If they did have peripheralization or reproduction of symptoms, we would go back to the last step for which they did not. So if they got radiating pain down the affected leg, I would move back to the unaffected leg being strapped in and not strapped in the affected leg. From there, we're going to find our start and finish positions. So I'm going to find the segment that is affected, and then from there, I'm going to place my middle finger on the interspinous ligament. I'm going to place my index and ring fingers on the paraspinal muscles adjacent, and then I'm going to go ahead and depress down on the table. As I'm doing that, I'm feeling for when the tension starts to develop between the interspinous ligaments. That's my starting point. And then as I continue to lower, I'll feel for where I get elastic tension applied to the paraspinal muscles. That'll be my finish position. So then when I'm treating, I will be treating in between those 2 points. From there, once I've got my start and finish positions, I readjust to my cephalad contact using either heel of the hand or thumb spinous, and I'm going to go ahead and apply 5 repetitions within that start and finish position, each one 4 seconds. So it's 1, 2 down, 1, 2 up, 1, 2 down, 1, 2 up. After I've done 5 of those, I'm going to apply my soft tissue treatment or trigger point release, and then I would repeat that process 2 more times. Once we've gotten through all of those rounds of treatment, we will bring them up, relock the table, take out the tiller bar, unstrap the patient, and then help them off of the table. So same thing, go ahead and tighten your abs as you get up, back your way off the table. And that's your flexion distraction technique.